Greetings everyone. We're going to be doing hamstring stretches, and again, always give thanks to Aaron Mattis for allowing us to share his great knowledge and his active isolated stretching. Today we're going to do, again, the proprioceptive neuromuscular facilitation in the form of contract relax. Of course, you can do reciprocal inhibition. We're going to hold stretches for 2 seconds, and the person is going to contract against our resistance, hence contract relax, for approximately 2 to 10 seconds, depending on what professional you talk to. So there's 6 hamstring stretches. First, we're going to do with the leg straight. There's 3. Then we're going to do the leg straight to bent, and then 3 different ones. Because since the hamstrings cross 2 joints, the knee and the hip, we're going to do the leg straight. But we could also engage the back of the knee, posterior of the knee, to get the guys back there. So we're going to do 6 stretches. Depending on the client, you're going to bend the knee. And I will come around the other side and demonstrate these on the other side. That way you can have a better perspective, but I want to just bend her knee a little bit here to take a little bit off the pelvis. You're going to bring this leg up. I don't want to see this. I want to see here, using your body. Your up table hand is going to be proximal to the knee. You're going to come here. She's going to push gently. Relax. We're going to rotate that foot externally. Same scenario. Not here, folks. In here. Use your body. Keep a good stance. She's going to push against. 3, 4, 5. Relax. Stretch. Now you're going to internally rotate. Again, not here. Can't stress it enough, folks. Come in here. Push against, 3, 4, 5, and stretch. So in a sense, you're going to be doing straight, externally rotate the leg, and internally rotate the leg. Does that make sense? Now, that's with the leg straight, more the proximal end, Let's worry about the distal end at this time. We're going to take them to their range. Now we're going to do reciprocal inhibition. We're going to bend that knee. Our hand is going to be wrapping around the knee. Our thumb is on the hamstrings to feel them. You take them to their range. Keep them in their range like a pin. We're not moving this. So we find their range where they feel comfortable. For their perception, I sense her. She's about right here. Can't see her head, but she's going like that. So now we take them to the range. We're going to bend the knee. Reciprocal inhibition says if the quadriceps contract, the hamstrings have to relax. Now they extend. Then we're going to externally rotate. She lifts up. She's tightening her hamstring. She's tightening her quads. And then we internally rotate. Up. So I'll demonstrate these again. We're going to take her to her range. There's that phase where she's going like that. Going to bend. She's going to extend. Reciprocal inhibition. So now our hamstrings at the distal portion are going to stretch. We externally rotate, keeping her in this position. And then we internally rotate. So what I'm going to be doing now is coming on the other side to demonstrate this. I don't want to just not face you guys the entire time, so let's try it this way. We're going to be bending her knee. Going to be coming here. Straight. Locking myself in. Push against me. Relax. 1. Then we're going to externally rotate. Push against. Relax. 2. Now we're going to internally rotate. Good position. Push. Relax. 3. That's more for the proximal end. Let's get to the distal end now. We're going to be taking them to their range of motion, where they feel comfortable. And again, if you saw her face, she'd be shaking and saying, yeah. My hand is grasping behind and proximal to the knee. That way my thumb could feel. She's going to extend with the leg straight. We're going to externally rotate. We're going to internally rotate. And as she contracts her quadriceps, one thing that I've worked on in my 28 years is cueing. This is very important in terms of stretching. We have to cue properly because they don't understand what we're asking them to do. So cueing slowly, gently, maybe a couple practice runs with them. That way they can understand and conceptualize in their brain what you're expecting them to do and what the outcome is. Always discuss outcomes. We're trying to do this because of this. So again, just demonstrate one more time. I'm not going to bend your knee just so that we can see a little more clearly. Here, proximal to the knee. Here, not out here, folks. Here. Push against, relax. 1. Rotate outward or externally. Get close in. Push for 5 seconds. Relax. 2. Internally rotate. Look at my body's positioning. Push against, keep it going, relax. 3. Then we're going to be doing, well, that's proximal. Now we're going to be doing the distal end. So again, we take them to their range. Don't force anything, to their range. They bend the knee. They tighten their quadriceps. 1. Externally rotate, tighten their quadriceps. 2. Internally rotate, tighten their quadriceps. 3. And that way we can isolate the proximal end and distal end, and we get tremendous results with that.